right, let's deep dive into working through the clean, one of the 2 Olympic lifts during your pregnancy. First and foremost, I want to make sure that you feel confident and comfortable that continuing to Olympic lift with certain scales and modifications is absolutely safe during your pregnancy. And there are different ways that we can help to mitigate risk to the pelvic floor as you continue to progress into your 2nd and 3rd trimesters. Previously, it has been thought that Olympic lifting might be an area of strength training that would be contraindicated during pregnancy because of the contact of the bar with the woman's body. But since we have learned that that is absolutely not the case, and a lot of the modifications that we make are to respect where your body is at in regards to pelvic health, but also from a performance perspective to make sure that we aren't instilling faulty movement patterns that we're gonna have to work to break those habits as you're returning to lifting postpartum. Unlike the snatch, where the contact point is in the pelvis, because for the clean, the contact point is in the mid-thigh, oftentimes women are able to complete movements with the clean a lot further on in their pregnancy than some of the modifications that we're going to be making for the snatch. General considerations when we're considering the clean during pregnancy. Number 1 is going to be range of motion. As we get further along in our pregnancy, our baby belly is going to be growing and growing and growing. And it can be difficult to maintain a flat low back, especially taking the weight from the floor during the end stages of our pregnancy, late 2nd trimester into 3rd trimester. Because of that, we may modify range of motion to give a little bit more room for the baby bump and make sure that you're lifting with good mechanics. The second thing that we're gonna consider is full squat versus power variations. And we're gonna go through all of these different movements. The power variations do not put you into a full squat. And for some women who may be experiencing something like pelvic girdle pain or maybe experiencing some pelvic issues like leaking in the bottom of the squat, the use of a power variation over a full squat variation may be a bit more comfortable. The third variable that we often manipulate is breath. If you are in the sport of weightlifting or CrossFit, when you are doing a clean, you do what's called a Valsalva, where you close your throat, your glottis, really inhale and squeeze and brace through our midline and use that to help with force transfer up against the bar. When we are pregnant, what that Valsalva does is it puts additional pressure down on our pelvic floor, which is already under a lot of stress and strain as we gain more weight and as our growing baby puts more weight down on our pelvis. What that means is we can use our breath as almost like a pressure gauge. And by using exhaling and inhaling and different ways of letting go of breath, we can actually manipulate pressure and allow us to continue to lift, hopefully free of any pelvic floor dysfunction. We're gonna go through a bunch of these variations, and you can choose where or when you're going to put these variations into play during your pregnancy. One last note is that the timeline for you to use some of these different variations is going to be very female dependent. Some women can continue to do cleans without any negative performance advantages in towards the end of their 3rd trimester. Other women, because of their body shape, the amount of pregnancies that they've gone through in the past, or if they're experiencing multiple births, there's again some yellow potentially like things to think about when it comes to multiple births that we can talk about in a different video. But all of those things are going to play an important role in when we take some of these modifications and scaling options and place them into your program. My hope with this video is that you feel empowered, that you have a lot of different variations that you can utilize, and when you get to a point where one feels uncomfortable, you have what's next and what's slotted in afterwards kind of ready to go. All right, let's get started. Okay, so let's go through a couple of different clean variations that you can utilize throughout your pregnancy to scale back or into your postpartum journey to scale up as you're trying to return to Olympic lifting. The first thing that we're going to consider is breath manipulation. As I mentioned in the intro, we think about our breath as this pressure gauge. And one of the hardest considerations for my pregnant athletes who are used to using that Valsalva, holding their breath for literally thousands and thousands of repetitions, is changing their breathing strategy to exhale as they're lifting the weight off the floor. So Brooke is going to be doing a full clean variation. She's going to lift the weight up to her shoulders, go into a full squat. She's going to try and exhale the entirety of the movement. Good. So you can see that is probably the first fundamental switch that we're going to make during pregnancy. It's also one of the things that we're going to introduce in the postpartum period before we start increasing and layering that pressure that your body is able to handle the further you get postpartum. The second area that we're going to start manipulating is the range of motion. Like I mentioned, it can sometimes be harder towards the end of your pregnancy. If you can still do the clean without making contact with the baby bump, that you might want to try a hang variation or a thigh variation, a higher hang variation, to just limit the range of motion to keep a better movement mechanic. So Brooke's gonna do a hang clean. So she's gonna bring it out to the hip, bend over to the top of the knee, and then pull the clean from there. Good. And then she's gonna do the same thing and just do a little dip, not all the way to the knee, and the same thing, go down into the bottom of the clean. Beautiful. Okay, so during your pregnancy, some women are going to be able to do full clean variations going into the bottom of the squat the entirety of their pregnancy. For some women, they may not feel comfortable in the bottom of the squat. That could be because of having pubic symphysis, or globally what we call pelvic girdle pain, which is any pain across the front or back of the pelvis or low back. They can also start to experience issues with incontinence in the bottom of the clean. If that is the case for you, one of the things that we can do is modify the depth of the movement by changing to a power clean variation. So Brooke's gonna do a full power clean from the ground. So she's gonna set up the exact same way as she would for the clean, but instead of catching in the full squat, she's gonna catch a little bit higher. From there, we can layer in different variations. So instead of doing a hang full clean, she can do a hang power clean and a high hang power clean. So she's gonna bring it up to the hip, down to the top of the knee, power clean, beautiful. Focusing on that breath, great job. Same thing, a little bit higher. And she's catching that power clean position, beautiful. Last thing that we can layer in, and this is something that I commonly program for my athletes postpartum, but can be very useful during pregnancy as well, is doing a no feet variation. So when a woman moves in the clean from the power position with her feet underneath her hips to her squat position, that jump can put some instantaneous ground reaction forces on the pelvic floor. By doing a no feet variation and starting the feet at the squat position instead of the power position, you are training, keeping the bar close in that triple extension position at the end of the second pull. You are also limiting the impact on the pelvic floor. So let's go through a couple of those variations. So full clean, no feet. This is, again, something that we have to train. It might feel a little bit awkward. Excellent. And then from there, all of the same variations start to apply. So let's not do the high hang, but we're gonna do a no feet hang clean. As you can see where I'm going with this. In that squat position, power clean, hang, no feet hang, full clean. Yep, in that squat, exactly. Yeah, so in all of those no feet variations, you can go through the different levels that we did when we were modifying load and range of motion by going into that no feet, hang, full clean, hang, power clean, high hang, full power, and to the floor, hang power. So give any of those a try. Know that once you get to one level, you can manipulate loading in those variations, or you can start moving across this continuum of impact and range of motion, but keep the load constant. Different ways to start progressing or scaling back, depending on if you're going towards the end of your pregnancy or starting to build back